Has your get up gone out and you can't get it back? Today, we're going to talk a little bit about hormones, erectile dysfunction, and the prostate. So stay tuned. Darren McDuffie here, alias the Fat Man, and this video is being brought to you by I'mTheFatMan.com. Today, I'm specifically talking to my boys, the men out there. And I'm specifically talking about hormones, erectile dysfunction, the prostate, and heart health. And you'll see how all of this interconnects in a minute. But there seems to be this belief that as we age as men, we tend to lose our sexual libido. You hear a lot of guys going around saying, I wish I was 18 again. And that's not the way it should be. You should be able to have your sexual function or your sexual libido way into your later years, and it's just not becoming so. In our society right now, we have a lot of younger guys electing to use erectile dysfunction drugs like Viagra and drugs like Cialis, just simply because they're losing testosterone. Testosterone peaks at the age of 30 years old. So that's the best it's ever going to be, so we think. But let's hold up, let's wait a minute, and let me explain something to you. So if it peaks at 30 years old, why are we having an abundance of younger men ages 20 to 25 who are electing to use Viagra or Cialis? And I'll give you a very simple explanation. It's because we're encountering a lot of estrogenic chemicals in our society right now. So what are estrogenic chemicals? Many people don't know that there are things that are being put into our meats like antibiotics, which when you eat those meats is counteracting your testosterone by turning into estrogen into the body. You also have a lot of personal care products. Women are probably the biggest users of personal care products, but you have men who are trickling in and using some of the personal care products such as moisturizers for the face, maybe aftershave, and they're not knowing that a lot of these products contain what we call xenoestrogen. So when they put these things on the skin, they're going to the bloodstream, and once they're in the bloodstream, they turn into estrogen and they're counteracting the testosterone. And I can go on and on about that, but the main thing that you need to understand is that as being a male, your testosterone is one of those things that you really want to protect, and you don't want that testosterone converting into estrogen. If it converts into estrogen, you'll see a lot of what we're seeing now where the men have the big bellies like basketball. You also have the man boobs or the moobs or what some people call them. And that's what's starting to happen in our society. And once that happens, you also have to know that your sexual libido is going to go out of the window. But this doesn't happen to happen. You have ways that you can maximize your testosterone. But before I tell you more about those ways, we have to understand a little bit about our heart. And my dudes, I'm going to share with you golden rule number one, and that is whatever affects your heart will ultimately end up affecting your erection. Let me say that one more time. Whatever affects your heart will ultimately end up affecting your erection. Now, what you have to know is that your heart is a muscle and it pumps blood throughout the body. If your heart isn't going anymore, guess what? You're dead. But if your heart has problems pumping blood throughout your body, then your erection is going to be affected just simply because your erection is based upon blood flow. And as we age, many men start to lose that circulation of that good blood flow, and therefore their erection suffers. So how is this so? One of the main reasons is because of the heart theory, where the cholesterol is actually, high cholesterol is actually one of those things that you want to stay away from. You actually want to have good cholesterol. It can be a little bit higher because cholesterol helps make hormones, specifically testosterone, and you need that as you grow older. So one of the lies that we've been told is that you should lower your cholesterol. And many people who go on these statin drugs or cholesterol lowering drugs, they tend to have a lesser of their sexual libido. They start losing out on their sexual libido just simply because their cholesterol has been lowered. Another thing that I want to tell you about is we keep eating oils that are not heart healthy. They keep telling us to go towards vegetable oils, and I think a lot of things are changing right now Whereas we're knowing that high cholesterol is not one of the causes of heart disease, but you do need to protect your heart by eating heart healthy oils. So as we're talking about our testosterone levels, we need to talk about things that affect our testosterone levels. The number one thing is vitamin D. A lot of men are woefully deficient in vitamin D. Your body can make its own vitamin D by getting out into the sun. I'm here in Florida. Normally when I go to the beach, I just lay out in the sun for about 20 minutes and then I get under my umbrella. If you're African American, you know we've probably been taught not to like the sun, but you need to get out into the sun because your body can make its own vitamin D through that. If you're someone of a lighter skin origin, then you need to get out for about 10 minutes and then get up under your umbrella at the beach. You don't need to spend crazy amounts of time in the sun because, again, it's just not how the body was built. You just need a little bit and not a whole lot. Another thing is zinc. Zinc has been found to help testosterone levels, and again, a lot of men out there are woefully deficient in zinc. And even if you think you're getting enough zinc, chances are you're not getting enough from your food because a lot of the crops and a lot of things that we're eating now don't have the nutritional maximum nutrition amount in them. Just simply hold up, news flash. In addition to eating heart healthy oils, you may want to eliminate sugar and soy from your diet. In studies, again, they have found that sugar increases estrogen, and as I explained to you, you don't want to use estrogen to combat testosterone. Soy is also one of those estrogenic compounds. I did a video a while back on the dangers of soy and how it can be attributed to man boobs or moobs, as I mentioned before. So again, you want to minimize your sugar content or sugar intake, and you also want to eliminate soy completely from your diet. Having good testosterone levels is directly dependent on having good cholesterol. One of the things that your doctor should do before they even write you a prescription for erectile dysfunction drug is to test your testosterone. They have been studies, again, I like to talk about studies because I do a lot of research where low testosterone has been directly linked to prostate cancer. So you can see how this cycle starts. We peak at 18 to 30 years old with our testosterone, maybe even not now, just simply because a lot of guys, again, are bombarded with a lot of estrogenic compounds in our society. So after 30, everything goes downhill, and you start seeing men with prostate problems in their probably mid-40s, early 50s is when they start having those prostate problems. If you're African American like myself, you want to start having your prostate checked at probably 35 or something like that is when I started having mine checked. But again, those lowering of testosterone is actually one of the things directly correlated with prostate cancer. In relation to vitamin D or low vitamin D levels has also been correlated with prostate cancer. If you are someone who has to have a prostate operation because you have prostate cancer, believe me, your sexual libido will suffer. You will have a decline in sexual function, and you don't want that. You really want to keep your prostate healthy, and the way that you do that is just by following the recommendations in this video. Another thing that I want to talk about is being able to use resistance training. A lot of men tend to shy away from resistance training as they get older, and they think that they don't have the time. It's been shown that if you can lift heavy weights at low reps, this helps you maximize your testosterone levels. If you're someone out there who is in your late 30s, going into your 40s, 50s, or even any age, you need to start doing some heavy resistance training. You don't have to spend all day in the gym. Get in there and do a good heavy workout, and that'll help you maximize your testosterone levels. So in closing, we want to make sure our heart is healthy to be able to pump the blood, because the blood flow is one of the main things that helps us with our erection. If you maximize your vitamin D levels, if you maximize your zinc levels, then you're going to have good testosterone, and that good testosterone equates into having a good erection, and you can hold on to your sexual libido. So this has been Darren McDuffie, alias the Fat Man, helping you become perfectly healthy and toned, and I will see you on the next video. Peace out, my dudes.